Good afternoon, everyone. We are from CGTN. I'm reporter Tu Huao. This is my colleague Liu Chen. We're reporting at one of the venues, one of the exhibition halls of the CIIE, China International Import Expo.
We've done so many live streams in other pavilion, either the country pavilion, the car pavilion. But today, now, we are here at the medical pavilion. So I know very little in this field. So you'll probably be the first one to be introducing everything.
We have to warn our audience that what we are going to show you today is very professional. In fact, it is a B2B kind of event as opposed to B2C, but we are still going to show you some interesting products and systems. For example, what we are right now in front of is the AstraZeneca UK, Sweden-based pharmaceutical company. They are bringing 7 new drugs to China this time. One of them is actually being first launched in China before it's going to be launched in Japan and the United States. And we're going to be joined by a lady here who will give us a thorough introduction of the Lung Cancer Center. 你好. Hi, we're from CGTN. We are doing a live streaming right now. We see that AstraZeneca is not only bringing medicines, right? It also brings its innovative system. Can you give us a tour of what you're showing here?
Sure.
I'll hold it.
Good luck. AstraZeneca is a British-Swedish company, and we've already invested in China for 25 years. And now we focus on oncology, respiratory, cardiovascular, and also GI field.
This is one of the 8 systems here.
Yes.
Okay. We'll take a look at the computer screen. Is that a lung or something? This is called Integrated Lung Cancer Center.
Yeah, so other than innovative medicine we provide for the patient, we also build up the ecosystem with our partner, for example, a digital partner, a device partner, and also cooperate with the hospital and the government to build up the whole
holistic system.
Yes. So now we provided for lung cancer is the integrated lung cancer system. We call it ILCC. And
what's special about it? It says on the board that you are establishing it with hospitals and regional detection centers. Is that a way to detect early for lung cancers?
Yeah, that's one of the key parts. But based on the whole patient journey, actually oncology patient, they have a very complicated patient pathway. So for these kind of patient, we provide a solution based on the patient-centric idea, from early screening and diagnostic, and then multidisciplinary treatment team. And also we provide a total care patient center. It is. For example, such as this system, we use the AI technology. Previously, for example, one patient, they take the CT scan for their lung, and the doctor need to take a long time to detect every nodule and one by one. But now, you only spend like 10 seconds with the AI system. It can show all the nodules in your lung, like 11 nodules, what's the size of it, and what's the type of it, and the likelihood of the malignancy.
You said within seconds.
Yeah, previously, for example, the oncologists, they may take 15 minutes for one patient, which is really time-consuming.
Exactly, we spend so much time to do.
We're
queuing up for the CT.
It's all separate, we have to go to each different place before
actually get the result.
Department by department, the patient actually really suffer, and actually lots of patients, they got loss of detection. They did not detect their early lung cancer. So based on this system, we save the physician's time and also
the patient's time.
Yeah, and then also the patient's time. And patient has better experience during their detection in the hospital.
Yeah. That's why it's called
integrated. I find it's easy to understand it. I worried
actually
so much.
No,
it's not that hard.
If it's going to be very dense. But thank you so much for the introduction.
Thank
you. So we've just shown you the Integrated Lung Cancer Center. It basically integrates the entire process of your treatment, from early detection, screening, diagnosis, treatment, and even rehabilitation. So it will save patients' time by a great deal.
Exactly. I just saw an ambulance here.
Yeah,
it looks different from what I saw before.
I know something about it. Actually, it's also a holistic system. One of the 8 systems put up with this by this company. It essentially it's a whole city model, if I could explain it correctly.
Well, I kind of understand it like whole city, like every corner of the city helps you to translate the patient into the hospital. Is that right?
It's actually using the technology called Internet of Things to coordinate different facets of the entire, medication process, including disease management, early diagnosis, quick treatment, and follow-up. So, for example, if you have a heart attack or some kind of emergency disease, you call the ambulance, and the system will be able to sort of coordinate, for example, the traffic lights, because a lot of times patients are stuck on the road before they even get to the hospital. Sometimes the surgery rooms are occupied. They have to wait even longer.
True.
Remember, these are some of the patients who are in
emergency. Exactly.
So,
if you have an emergency at 5 or 6 o'clock in the afternoon.
Exactly. So the technology called Internet of Things will help alleviate all those problems and try to bring different parts like governments, hospitals, transportation, urban management, bring them all together in this one system called holistic ecosystem. So we just shown you the UK, Sweden-based company. So as we told our audience, it's not just about pharmaceutical products like medicines. What kind of medicines do we? In fact, you don't even see that many medicines here.
No,
right?
That's true. Yeah.
There are medical devices, but there are also innovative systems.
Oh, just a quick reminder that we are live stream on Facebook, CGTN Facebook, CGTN application, and Weibo. If you have any questions, you are very welcome to send it to us, and we will see it on our phone, and we will try our best to answer you.
For sure. In fact, this is the 4th day of the CIIE, China International Import Expo. Liujun, what's your impression so far? You've been here, pretty much every day, right?
Well, the first impression I have is it's massive. The building is huge.
A lot of walking.
Exactly, a lot of walking. And then the thing is, even if I have been here for 4 days, I haven't gone to every pavilion. I really want to go to the food
pavilion. I know you're going to say that. No, not yet. They say a lot of samples, a lot of great stuff.
Exactly.
I actually can't wait. In fact, I've been running around these pavilions. I've seen, high-end equipment, for example, smart technology, and this is the medical device and pharmaceutical healthcare products. My impression is that, like you said, it's massive. And the reason why the government put up such a gala, import gala, first ever in the world to host an import-only event is to try to send this message, right? That
to the
China
world,
wants
also
to
to China.
Transform itself from the biggest exporter, from the image of the world factory into sort of this idea.
World market.
Yeah, like we are the market, we are the importer. We want to buy from the world.
Exactly.
That's the message it's sending. And we're definitely seeing it. A lot of media, a lot of buyers. For example, 300,000 buyers are coming every day.
Yeah.
And also a big number of crowds. Like in fact, for security check and everything, you gotta wait patiently because there's just so many people who want to be here.
And I heard there are over 5,000 volunteers helping out in these 6 days.
Think about all the work that's put into it. Right now we've arrived at another booth. It's called ESLA, right?
Oh, we're just, sorry. ESLA. So what do they offer?
Yeah, I'm curious. I think I've heard that they are able to sort of detect your, examine your eyesight within like a very short period of time.
Oh, because I never wear glasses, so I know very little of this brand. But maybe we can.
我们是 CGTN. We're doing live streaming right now.
So is there anyone who
Is there anyone
help
who could
us
tell us a bit about your eyesight examination device?
Machine, so yeah, let me
Why don't we give a tour, okay?
Okay.
Yeah, but I need the right guy to guide you through because I'm the right guy.
It's okay, it takes time.
It's okay.
It's okay, we can wait. Sure. Sure. Okay, so
Well,
this is the first time.
there it says, improving lives by improving sight.
Exactly, it really helps. If you can't see it,
Well,
you can't do anything.
I kind of regret that I didn't know this earlier. I'm already wearing my glasses.
See what they have. They actually introduced so many equipments. Yeah, it's one of the busiest booths I can see in the whole medical pavilion.
So for web machine, this is more for eye health screening. So thanks to the high technology through this web machine, we can use only 2 minutes. Yes, less than 2 minutes. We can actually screen about 7 key things about your eyeballs. Yes.
Like what?
Eye
For
care,
example?
not only eyesight, but also such as cataract, this kind of key eye diseases. So I think I will.
Shall we take a closer look at it?
Yes, sure. So
Maybe we can wait.
We have
It's
some
okay.
media friends.
Okay. Yeah. We want to take a look
Take a look at this.
this computer
Yeah.
screen, if that's okay.
Yeah.
So, Dr.
Just
Mai,
give us a very
Dr.
short
John,
introduction.
Dr. Mai, sorry. Can you briefly?
Yeah, can you give us a tour about like what we're seeing right now? What's on display?
Okay, okay, no problem. Yes. 稍等一下。
So what
What
did
is
you just
this?
do? What is this? She mentioned to me that this is something that can be done within 2 minutes.
Yes, and there is something we can see in this screen in 2 minutes. 2 eyes.
Two
And,
eyes?
Yeah, we can see over 1,000 data. Eyeball. Over
1,000 data for
eyeball
just-
data
Wow.
in 2 minutes.
Wow.
But we don't know our patient to see so much data, right?
Right.
So we just put some significant data to analyze into some total package or total solutions for their life, for their eyeglasses.
What kind of technologies are behind it?
Yes.
Big data system, I would assume.
Yes, it's one of these. I believe the most difficult things is all about we combine all the things together.
All the things together.
Yes, you know, if we are in the eye hospitals,
Only one thing or a couple.
One
you
was
you
a
need to
time.
wait, right? You need
Yeah.
to wait once in one time to see maybe 1 or 2 the eye problems. But we can see
Have 1,000 days.
over 1,000 data in 2 minutes.
Wow.
But
That's amazing.
we can use the AI technologies. We can combine all the significant things in this one screen. So you can see this is the patient. We just look at it for eyeballs. This is the things we can look at. This is the things for the visual acuity in the daytime, and this is the visual acuity in the nighttime.
Wow.
And this is the things we can look at for the eye fatigue,
It's very in details.
right?
Yeah.
So who are the buyers usually for this kind of product? Is it hospitals or is it, I don't know.
Individuals.
You know, there are 3 channels. The first one is the optic stores, right? We can sell this kind of machine in the optic stores and do the eyeball screening. You know, this is the first
On-site,
channel,
right.
on-site. The second channel is all about the physical examination center,
Physical examination.
right? Yeah. But right now, there are a very limited resources for the eyeball examination in the physical examination center. But this will enhance the eyeball examination. Okay.
Is there any hospitals in China have imported this
Have
kind
already.
of? Yeah.
Maybe next year.
Next year.
Yeah, maybe next year.
It's still new in the market.
Very new in the market. And the third channel is all about the eye hospitals. Small one is eye clinic and the
Public
big. Yeah, sure,
hospitals.
of course.
So during the 4-day conference, is there many people come and ask for this
Wow,
equipment?
you have
Yeah.
to
Could you
Look
give
at
me
the
the
line,
number?
just look at
How
the
many
line.
contracts
1
you
hour.
sign?
Yes, it's crazy. It's crazy.
Oh,
But
really?
it's very interesting, right?
Yeah.
2 minutes, a lot of things. But we can see them. We can see the eyeballs in a very simple way.
Do you want to try or something?
Can I?
Sure, of course.
Can you try?
Please,
Yeah.
Just wait for 1 minute.
Sure. 2 minutes. Yeah.
Okay.
We have 2 minutes.
Sure.
先生
Eh,，
你好，我们能那个
我们能
稍微试一
试一下吗
下吗？
能不能让媒体先？不好意思啊，抱歉。
Sorry.
谢谢。Okay, I got the privilege. Thank you. Just 2 minutes. So what do I do?
Sorry, I just. Okay. Okay.
So sit down first.
Sit down
Definitely.
first. Relax.
Okay. Very relaxing experience.
So I need to quit from the last patient.
Ah, okay. So do they need to spend a lot to buy a machine like this?
Is it expensive?
Yeah. If I am a patient, I want to use the machine to do an examination.
Yes,
Would
sure,
it cost
of
a
course. Sometimes it is yes, especially for the eyeballs screening. Yeah, just put your chin here. Put your chin here, yes. Okay. Looking ahead. Okay.
Liu Chen, does it feel anything different from the ordinary type of machines you would use?
Till now, it's okay. It's basically the same.
It's basically the same. Oh, I can see your eyeballs right now. Oh my
Yes.
god.
Oh, thank you.
Here.
Does it look
哎，我
good?
们可以看一下这个屏上了哈。
好，不要说话
That's
哈，
for
不要说话
eyeballs.
Okay, just start.
It's focusing it, right?
It's focusing automatically.
Automatic focus.
Yes.
Kind of scary.
It's scary. It's beautiful.
Oh, it's beautiful. Yes, beautiful. Since when did Eslo got into this field? Because we know this is a company that's known for making eyeglasses.
Sure. Yes, of course. If we just served as a manufacturer, so I believe it is not good enough.
It'll be out of date.
Sure, of course. So right now we just put out all this technology in screening field.
Screening is sort of the future
Sure, this is the
area of competition.
Yeah, and it will.
The better screening results, the more accurate.
Sure. It can serve a lot of people. It can serve a lot of people. Let the people know.
That's a common concern for people because sometimes you worry that if you go to a sketchy place where the screening result might be a little bit off, that would affect your eyesight, even like in a negative way.
Sure. So we wanted our patient to understand with more frequency, right? Maybe you can just go into the optic stores, maybe by quarterly or half a year, and you can read the data and compare the data before. So this is a thing can understand my eyeballs, yeah, in a very decent frequency. Yeah. But if you want to go to the eye hospitals, maybe in China you need to wait maybe 2 and 3 hours. You will lost of your patient, right?
For sure. So it's all about efficiency and accuracy thanks to the technology. So what stage are we at right now? Is it still measuring, examining?
Yeah. We just finished the right eye and start to test the left eye.
Liu Chen, I'd assume you have pretty good eyesight, right? Are you wearing any lenses? I don't think she can hear me. She's too concentrated.
Yeah. To be frank, the patient need to stop talking. Yeah,
because that would affect your eye pressure and everything.
Yes.
It's very interesting. I do see you have a ton of potential partners, I'd say.
睁大眼睛，有气会往前喷。正常眨眼。
A lot of blinking.
Yes. Okay.
Is it done?
Wow.
I've got so many to
It is
say.
about
I've got
2
so
minutes.
much to say. I really need to say something because it looks like a
How do you
normal
feel?
examination machine. It's good. The thing is, if you look through the lens, you can see a picture at the end. So if we do normal eye examinations, there'll be people standing beside you asking you, oh, is it clear enough to see the picture?
Which is a very vague term. What is
Exactly.
What is clear? You know?
What is clear? Yeah, is it clear enough for me? So they might change the lens, like glasses, all the time to ask you whether it's clear.
It's a very kind of traditional method of sort of determining your eyesight, but thanks to technology like artificial intelligence, it'll be much more accurate.
Exactly.
Now we're waiting for a result. In fact, it's
So
already
what's my
out.
result?
Yes.
Can I see it?
Yeah, first of all, you need to look at where is red.
Where is red?
Where is
Where
red?
is in
Where-
red? Where is
Ah, okay.
in red, right?
That's
so.
what does it mean?
What does it mean? I don't even understand it in
Yeah,
Chinese.
okay. No problem. If I want to say something about your eyeballs, I want to see where is in red. So here
okay.
is some little problems I can explain
right.
to you, right? But because there are a lot of data.
It's marked in red to warn you, to give you
Sure.
a warning.
Ah,
What could
okay.
go wrong?
Just
or-
like your blood test.
I see.
You can see the arrows, but in here, from the 1,000 data, you can just look at what's in red.
I
So
what is in red?
okay, so we are looking at the first thing. This is vision acuity in the daylight and in the night, and this is these things. You have no
No, what?
eye fatigue.
Oh, eye fatigue, meaning you're not tired. You're in
Glad.
perfect health.
The muscles in your eyeballs very healthy.
Oh, I'm glad to hear
Well,
that.
that means that
Thank
she
you.
needs more work, right? She's not
No,
like,
please.
Okay, it's terrible, right?
you don't have any fatigue.
Yeah,
That's what
so
you said.
Thank you.
from the eye doctor's perspective, the muscles in your eyeballs is very, very strong.
Strong.
Ah,
It's very,
right.
very strong. But sometimes, if we are looking at this number, it's terrible because we have a lot of work in a very
okay. So you probably
short
have problem
distance.
of this part if you read too much or you work for too long time.
You're right. If there is some number,
Glad
or,
I'm
or
young
one
enough.
or
Well, no, I think there's some deficiency in reading. You need to read more.
Yeah.
Does it mean I don't work that hard?
If there are some numbers, if there is numbers in red, so we will recommend the patient to wear anti-fatigue lenses.
Right.
Yeah, so
right.
there will be a solution. Okay, so this is the test the surface, your eyeball's surface.
Ah, okay.
It is smooth or not smooth.
Right.
Okay, so this is the things is very smooth. Your eyeballs, the surface of your eyeballs is very smooth.
Okay.
But when we are looking at something in red, this is a little bit difficult because when we are test the vision acuity of your eyeballs, it's only about this is the
eyesight,
yeah,
true.
the spherical, the astigmatism, okay, is there on. But there are a lot of things in your eyeballs, such as if you are at night. If you are at night, you are driving. You are looking at some.
I drive a lot at night.
Yeah, you are driving a lot.
I do drive.
So this is something you need to wear some driving lenses. Because
okay.
of this is in red. This is the red. You can tell you if you are do a lot of things in the speed. You need to be cautious.
I found it. I actually found it when I drive at night. I found it a bit hard, so I drive really slowly at night.
I really
Very slowly,
think this
yes.
is like a diagnosis session already. Okay. I think we got the idea. Thanks so much.
Yeah, thank you
I
so
think
much. We spent too much time
At
here,
the
but I
end of the
love
live
it.
streaming, I'll come back and hopefully I'll get my result. I think I had
It's a
terrible eyesight.
free test.
Like the slogan
Welcome.
says, improving lives, starting from improving sight.
Exactly.
Thank you so much.
Thank you
Yeah,
so much. It's
Thank
great.
you.
It's great experience. Thank you. Oh my God, I
Wow.
love that.
We-
He actually detected my problem in 2 minutes.
It's all reflected
amazing.
in data.
Exactly.
Right? You even know your data. You can even get a report later. Like, where should we go? It's like
Is this the last destination, or we go
we're
to the
going
next?
to another one.
Yeah, shall we?
Sure.
Oh, okay, it's over there. So let's continue. Yeah, it was amazing.
That was quite an experience, right?
Yeah, I got nervous when I was using that machine. I found it. I mean, you don't need to do anything. Well, at the end, there is a liquid just push into your eyes. I was like,
There's literally liquid pushing in your eye.
Yeah, it's a little bit, but it's okay.
So where should we go
So
next?
here is the last destination of the live stream today. We can see the machine over there.
Okay.
And we have an expert who is going to introduce us what this is. Because I did the research beforehand, and this machine is one of the 10 must-see products of the CIIE.
Of the CIIE,
yes,
wow.
exactly.
Well,
so
are we going to be welcomed by a gentleman who can give us an introduction about it?
Exactly. Hi.
This is our CEO.
Hi.
Hi.
Nice
Hi,
to
meet you.
We're from CGTN. We're doing a live streaming, and we see that this is a MRI system.
It's actually for baby MR. We will call it neonatal.
Neonatal.
Basically, it's for a baby from a newborn to about 2-year age. So if you look kind of closer, this is the world's first we call it neonatal MRI system, which is designed, built for children's hospital, for all the major hospital in we call NICU units, intensive care, neonatal intensive care units, was basically designed, built for babies.
So typically it's just ordinary MRI systems, but this one is specifically made for children.
Yes, we have 3 innovative approaches for this type of thing.
But why do we need an MRI system just for babies?
Okay,
yeah.
first of all, when you have a baby which in the disease stage or in the early stage of happening disease, we don't know how to diagnose this baby, right?
Are we going to put babies on this
no,
platform?
this is the first one. The issue is that how can we put a machine or testing? You use ultrasound. However, ultrasound resolution is very poor. So the second project, we're using X-ray. Don't forget, we're talking about
babies.
Baby.
Baby
and
are fragile.
brain head is not growing yet. You cannot use X-ray. So the last frontier will be MRI. So the trouble is that you have to carry the baby into an incubator with all the tubes together into another building, into another house for MRI screening. Now, our design is putting the machine into where the baby is. That's the first thing. So in other words, we are building a smaller, unique MRI system just installed into the NICU units, installed in the baby hospital.
I'd assume Chinese hospitals are your main customers.
Well, let's put it this way. This is the one with the largest population. Particularly now we open the one-child policy.
One-child policy is
Exactly.
So let me put it this way. There will be more, like a 3 to 5 million baby come along. It's incremental. So after the policy change, so every year. And then you have more baby in the hospital. Also,
need kind of diagnosis.
No. There's another point you have to think about it, because the second child, third child baby is most come from with the woman a little bit older age. So there's more defects come along. So we have a die in China to need all the children's hospital, we need the children's doctor, and of course you need more diagnosis for babies.
I want to get to this idea of showcasing your latest product at CIIE, because it is China's very first import-export. What do you think of the opportunities present to your company?
I think, number one, this is the world's first product design built for the baby. I already mentioned it's a tiny and smaller and more convenient. But another point is a very fast screening. So it will take 5 to 7 minutes to screen. Now, where is our customer? China alone has 3,500 women and children hospitals. You think about each county, each county has a women's hospital.
But this is a different kind of exhibition from anything you've showcased before, right? This is an import-export.
It's true. This is China first import. We are so happy to be presented as U.S. technology coming to China and benefit the Chinese.
This is a U.S. company.
We are original from Columbia University. I was a professor at Columbia and Harvard Medical. So we are a U.S. research team. However, I do have to mention that most of our parts is manufactured in China. So it's a combination.
There's a lot of tensions going on between the two largest economies.
Exactly.
So for your company, it's a demonstration that you're interested in China.
True.
I'm sure that we are aware we came from the top leading university from Harvard Medical and Columbia. Those universities is also global. So in my view, it's very simple for our high technology company, our particular healthcare company, we have to look at the global, regardless of which country boundary. So this is the benefit for the whole world, not only for China, or not only for US. Even though we are US technology company and we are more towards Asia, towards China.
Thank you. Thanks so much
it's
for the
really
introduction.
Good. Thank you so much. Thank you.
I think that is
it's
really inspiring because we keep hearing about this tension between.
We want to have a more.
Thank you.
We keep hearing about this tension between China and the U.S. How things are things really that hostile? And he was saying that in China, producing for China and for globe.
Exactly. So babies from every country in the world can benefit from all these technologies, even if they're from the US and they're promoting their products in China, however they're facing to the world.
This is a good sign because China wants to put out this image that we are inclusive. We want to provide more opportunities, not just for China, but also for the world. And we want to buy more from the world, especially technology and high-end products, such as all these technologies we're showing you, which include artificial intelligence, Internet of Things, and we've just seen MRI. And that is the case with pretty much every single pavilion at the National Exhibition and Convention Center, because we, over the past 4 days, we talked to a lot of CEOs. They say, wherever there's opportunity, wherever we go. That's the message we want to send here.
So that's the point of the CIIE. So I hope you enjoy the journey with us today at the Medical and Healthcare Products Pavilion. Even though we gave a really warm reminder at the beginning saying, oh, this is it's going to be very technical,
but even for an ordinary consumer, there's a lot of interaction.
Exactly.
Activities.
I
you can
have
actually
fun.
have your eyes checked, more about your eyeballs like
exactly.
that. So
it's fun. It's fun.
And we have to remind our audience that the CIIE is not just operate for once. It'll go on and on in the future. So for those of you who want to see the latest technologies and breakthroughs, this is the best place to be. I think that will conclude our live stream.
Exactly. That's a very good conclusion. And thank you for watching the live stream with us.
We'll see you next time.
See you next time.
Bye-bye.
Bye.